Hi y'all, I wanted to make a quick video today on how to screen yourself for perinatal mood and anxiety disorder. Now what this is just a quick screening questions, 2 questions that you can ask yourself or ask others. And if depending on the answers to these questions, they are red flags that further assessment is needed to rule out a perinatal mood and anxiety disorder or postpartum depression and anxiety. So think of the screening just like you would a self breast exam, right? So you know how you go to the gynecologist, they do that screening. And then there's also, I know one time I had in my shower just a little card that I hung in my shower that just kind of walked you through a self-assessment or self-screening that you could do to yourself while in the shower. And if anything was abnormal, you call your gynecologist to get further assessed, right? So why don't we do that for perinatal mental health, right? So that's why I'm gonna make this video. So the question you can ask yourself, the 2 questions, and this is the question I ask everyone that comes through my door for assessment. And it's a question that's not so obvious because it has to do with sleep. And that's why I want to make this video, because I need you guys to pay attention to the phrasing of this question and to really pay attention to what I'm saying here. So, because it's important. So if a mom comes to me and says, I think I may have postpartum depression and anxiety, I'm not sure, these are my symptoms, I also ask this question right away I'm like, okay, so let's say that you had the perfect scenario set up and your baby was sleeping through the night, or not even all the way through the night, but through stretches, right? So they're sleeping at least 5 hours. And if you were given the opportunity, you had a bed all to yourself, nice, comfortable bed, your perfect sleeping environment. Just think of your perfect sleeping environment. And that was handed to you on a silver platter and said, here, mom, here you go. Would you be able to sleep? Would you be able to calm your mind and body enough to get hours, at least 5 hours of uninterrupted sleep and be able to rest? And if you answer no, I won't be able to do that, then that's a huge red flag that further assessment is needed for perinatal mood and anxiety disorder. And then the other question is the obvious one, and that would be if you're having thoughts of self-harm, thoughts of harming your baby, or thoughts of suicide. That's a red flag. Of course, so we do need to reach out immediately for help. But the sleep question is not so obvious, and of course, because less sleep is to be expected and is common with a newborn and with a baby. But no sleep is not. So if you're not able to sleep, even given the opportunity, I highly encourage you to reach out for further assessment, right? And like I said, it's assessment. We want to further assess to make sure there's not any other medical reasons going on as to why you're not able to get any sleep. So I hope you found this helpful. And if you are having questions about whether or not you have postpartum depression or anxiety or another perinatal mood and anxiety disorder, reach out for help. You don't have to have the right answer to these 2 questions. So even if you're not feeling like yourself, I want you to know that don't ever think that your symptoms are not severe enough, and don't think that you're not sick enough to reach out for help, because this is hard work. Being a parent's hard. And so just know that you're not alone. If you're worried about how you're feeling, we can assess further and get you the help you need. So, and then also, if you are a friend, a family member, or a professional working with the perinatal population, I hope you ask that question. If you're wanting to do a quick screening and you don't really know like whether or not to refer your patient or your client for further assessment, if they're not able to sleep, if you ask them that particular question and they say no, that's a huge red flag that further assessment is needed. So I will be linking those 2 questions in the comment section so you can have those with you. And please know that, of course, it's not a diagnosis or anything. It's just a quick screening. So you can actually go get further assessed and get the help you need. So thank you guys for watching, and please like and share if you found this information helpful.